I know that you and your wife were able to be insured actually through an ACA plan.
Yeah. My wife, after we bought our policy, honestly, we had no health insurance without my wife before ACA, and about 4 months later, she missed a step and broke her ankle. And I can't imagine what that would have cost without insurance.
Yeah,
and we would have, it would have been blown us away financially. She probably wouldn't have gotten the care and the rehab that she needed. And and then 4 months ago, my brother-in-law also, they didn't have insurance without the ACA. He developed some benign growths in his abdomen, and they had to receive radiation and surgery, and I can only imagine what that would have cost without it. So I've had two personal, close to home relatives, if you will, that have been saved by the Affordable Care Act. So I have a keen appreciation for it, and given our healthcare struggles in Braddock, I don't think anyone could have a more keen appreciation of like what it's like to have healthcare, to have it taken away, and then have to fight for 5 years to bring it back.
What I am interested in, even with the ACA in Pennsylvania, we still see hundreds of thousands of people still struggling with uninsurance who weren't covered by the ACA or underinsurance, like a plan maybe that they could get through the ACA, but it doesn't cover their outpatient surgery or doesn't cover everything that they need. And so I was wondering, if you're elected in the Senate, what you'll be doing to commit to working for Medicare for all.
Yeah, well, again,
like Bernie's plan, I guess.
Yeah, Bernie's plan. I think ideally, when the ACA was adopted, I would have. I was a big fan of the Sing. Gosh, I'm drawing a blank. Yeah,
single payer.
Yeah, or the public option at a minimum. Nobody thinks that the ACA was perfect, but at the end of the day, the ACA wasn't ideal because you had massive obstruction and you had to cut all kinds of deals and everything like that. So I would absolutely support the idea of Medicare for all. And I think it's going to be an evolution towards that, not a revolution, because at the end of the day, states still control, like the way they've, resisted Medicare expansion, Medicaid expansion and things of that nature. But yeah, I think that should be the goal, where everyone has health insurance, and it is a fundamental right as being a citizen of this country.
I'm happy to hear you say that.
Yeah.
Do you have any advice for us trying to push that issue on the other candidates as well?
Yeah. Well, I mean, I don't think so, because they're going to respond. They're only going to respond to polls. So I don't know what it polls like. I just know what a community looks like with healthcare, and I know what a community looks like without. And I know, as somebody who wasn't able to get health insurance because my job didn't provide it, how amazing it is to have the ability to have health insurance, and I've seen firsthand what that means. So I'm not here to give advice. I'm just here to share my story, and it's just, I've seen both sides. I've been on both sides, and life with healthcare and life with insurance is much more just. It's much more fair, and it's much more. It's just a nice, easier way to live. Without living worrying that, oh my God, what happens? Again, if my wife broke her ankle, there's no way we'd have cut on with $30,000 and we would have had medical debt. Who knows what that would have turned into?
And unfortunately, what we know now is that a lot of the people who actually go into bankruptcy from their they have insurance. So the insurance companies like Debt Free Roma are not helping us.